again, testing at a time, and you guys just alternate. So if a person's doing Foley, then you'll be doing the trach. Next week is all supervised practice, so you can just come into the lab, and I'll be here, and you can practice again any questions that you have. All right, I'm going to move this table. Can I come up?
Which end are you going to work
under
on?
This way. For the trach. Yes,
This
thank
end
you.
or that?
What'd you say?
Which end are you going to start on?
Oh, I'm doing trach. Yeah. All right, so for the trach care, you need to have your trach cleaning care tray, the suction catheter kit, and you need to hook up the suction to the wall just like this. You don't need that other connector or adapter that you needed for the NG. You don't need that at all. Now this is always a two-person procedure because you need someone to oxygenate your patient in between when you suction. So that's what this ambu is for. So when you find it over there, it's just smashed and just pull it out. This connects directly to the trach. So this is so your helper can give 2 breaths. And then they disconnect, and then you're able to do your trach care. So you want to bring this for the skill at the bedside and just set it at the side. You don't have to actually do the ventilation, but you want to verbalize, my helper would now give 2 breaths. So that's an important part of the skill. Let's see, the person will pretty much always have their head somewhat elevated. So just go ahead and put them about 30 degrees. Because when they have a trach, you don't want fluid going back and forth, so they always have their head elevated. And you want to make sure that your side rail is up on the opposite side. For the skill, you'll need fluid. So I just tend to set things up this way because this is the order that you'll need everything. So what I do first is remove the dressing before I even do the actual suction part. You can, if you don't want to remove it before, you have to remove it before the care portion. But I just go ahead and remove it. So it's the first thing I do, and it's the last thing I do when it comes to this skill. So then I just open up everything. Open up furthest from me so I'm not breaking sterile technique. Each kit has their own glove.
Would that tube be connected to him the whole time up until you're ready to take it off and give the tube?
This?
No, the one that's connected
Suction?
to the wall.
It's not going to go in and out.
It's
for
okay.
the junction.
Okay. So he can just breathe out of that? Just okay.
Yeah. Now, if they have a vent, then there is the sterile suction through the vent. And that's not something we're going to actually learn. We're just learning how to do it this way, not the sterile closed suction. We're not learning that way. Okay, so this here, when you open up the kit, you can see this is right on the outside. Some of your kits, it may be on the inside, so when you open up the flap, then you will see this actual cup. So this is where this is confusing because, all right, it opens up on the inside. So all you do is just take it, pinch the corners, and you can see that's the inside. Do not do that. Okay? So whichever way you pinch it, if you accidentally pinch it upside down and you're like, wait a minute, it doesn't matter. You can touch the outsides of it, just don't touch the inside. And this is where you can pour in some liquid. So it's all about the inside, just don't touch the inside. And I just set it over here. And that is so you can clear your suction if you need to, if there's a bunch of gunk inside when you actually suction your patient. And this here, your gloves are not in a package like they are there. So they are just one on top of the other. So you have to figure out where the flap is, and it's a small flap. So you see I have very little room to actually grab it. So that's why you definitely want to practice. And you can see the glove, the thumb is turned around. All right, so I've got my gloves on. All right, and this here is the sterile part. So this is your suction. This piece here, or this end, actually goes into the trach and does the suctioning. This connects to the wall. And you can see a hole there. And that is where you put your finger over to intermittently suction your patient only on your way out. So one hand is sterile and one hand is non-sterile. So you pick and choose if you want left or right. My right hand is sterile, my left hand is non-sterile. So that is where I will touch this suction and I connect to here. And then I turn my suction on. All right, now this is where you can test your suction. So your non-sterile hand will do the intermittent suction. You don't take your sterile hand and do that. This stays sterile. And this is where you can actually test and make sure your suction is working. And you can see fluid going through the tube. This is where you will verbalize. My helper will pre-oxygenate my patient with 2 breaths. So they give 2 breaths. You go straight in until you meet resistance. You stop and then you suction on your way out, turning. Now, a lot of times when you come out on a real patient, you may have like what's known as a booger on the end. You hold on to the suction, which will keep it attached to here and nice and clear. All right. Because once you let the suction go, it'll drop it. Okay. So when you have something and you grab it, keep the suction on it. All right. So then you could do the same thing. You go straight in till you meet resistance. And on these mannequins, they don't go far, and then you just suction back and forth. Turning off and on a suction, and that's it. You do 2 swipes. If you have to do more than that, then you have to pre-oxygenate. You want to think of a live person when you're actually doing this. You're initiating their cough reflex, and they're going to be coughing and gagging while you're actually suctioning them, which is a good thing, but they need oxygen, so that's why you need to pre-oxygenate. So you just do it twice, and you would say, my helper will pre-oxygenate again with 2 breaths, and you go again. Go straight in till you meet resistance. And then you suction your way out, turning back and forth. All right, so that is the end of the suction portion. So now you're done. So you can take this, pull it off.
3 times?
Huh?
3 times the suction?
Twice, pre-oxygenate, and then you can suction one more time. Yep. All right, so you're done with this, and then you can just take this stuff, ball it up in your glove, because in the real setting, it could actually be really dirty. All right, so then you're done with this. So now you move directly into the care. You can go ahead and pour your liquid here, so you can clean with, and then you can take out your gloves. And this is the standard, however you want to put on your sterile gloves, just make sure you maintain your sterile technique. And these gloves are the way that they should be.
Backward.
Nails.
No.
Your fingers are in one.
Yeah, there we go. Now I keep that paper because the inside of it I can use for trash because it's still sterile. Alright, so this here is your drape. Don't get so caught up with, oh my god, I put the shiny side up. It should be down. If it isn't, it's fine. Just move forward. Alright, so this is your trach tie. This is what you will replace. This here is your new dressing that you will apply. And this is the last thing you do. And then you have 2 gauze to clean with. You have this brush here to clean the inner cannula. You have these here if you need to help put the tie underneath or whatever you have to do. You can create little hooks. And then you have your Q-tips to clean around the stoma. So with these, you just wet your Q-tips. Use at least 2. And you always want to hold on to the trach to make sure it doesn't come out, because on some patients it can actually move. And you're just wiping around the stoma side. So you have your one, toss it, use your second one. And you're just going around. You get any dry blood, any mucus plugs, anything that can be around here and that can actually go back into the opening, into the lungs. That's 2. This gauze here, you can use this as extra. So if you need to get any more blood or anything from around. And whenever you manipulate the trach sites and the cannula and everything, you always want to hold on to it with one hand. Because the last thing you want to do is to do all this and then it comes out. You always want to have a hand actually holding it in place and helping to turn it. So that if the patient coughs, they're not, by them coughing, they're not spitting it out. Your hand is there to try to hold it down.
What would happen if it did come out? Is that like an emergency?
They would put it back in, so that is where they would just put the inside to, okay, so when you take this out, it's just round. But the innermost cannula has like a more of sharp tip. They'll put the inner cannula back in here and push it back in. But the innermost portion, of course, you don't leave in, because then there's no opening. So if they were to accidentally eject their trach site, they can put it back in. They just would insert the innermost part. All right, so I've cleaned. So now, this is a non-disposable trach. So that means that when you take this out and you just turn it, and you'll hear it click. You just turn it, take it out. That means you can't throw it away. Some, you could just take this out, throw it away, put another one in, then you don't have to worry about cleaning the inside. The inside of this can contain blood, mucus, anything. So that is where you take your brush and you can brush down in there to get anything out. You can also take your fluid and pour it, but you want to make sure that when you do it that the end part is actually in the container. I've seen students do this and it shoots out. So you can do that. That's all you do. You just clean it, making sure that that airway is patent. There's nothing blocking the air or the flow of the air. And you just put it right back in. And turn it and you'll feel a little click. And that's it. And now you're going to change your tie. You always do one side at a time. So you're going to undo this side. And notice I'm holding it down in place because you don't ever want to have both hands off of it. You always want to have a hand down. Go around. We'll your head up. And then you do the other side. Now sometimes it will be a Velcro strap. And if you see those are a lot easier. Sorry. Give me a second. Urban.
Sorry, you're in range. You're in firing range.
Of what? Oh, yeah.
Or the stuff comes squirting out of there if they call?
Oh yeah.
The very first time I went to ICU as a student nurse, I was caring for a patient who had a trach, and I was at the patient's door, probably where I was further than that, where that board is, and he coughed. And the spit literally came out of the trach and landed on my foot. I did not want to enter the room. I was in the doorway. I was like, "You expect me to walk to the head of the bed?"
You're looking at yourself.
Yeah.
Here's the stuff.
Does it smell or anything? Or is it...
Well, it's your spit. It's your mouth. So if they have bad breath.
A lot of...
Now, in a clinical setting, you could cut that. But that's how you replace the ties. And then you just put your dressings back underneath.
Doing a regular knot there or a slip knot? So
I just did a regular knot.
So the next student can
Yeah, don't do the slip knot with the restraints. Don't do that. No, because then they could grab it. Yeah, and then it'll loosen it. So you actually want a real knot, so that if they pull on it, it makes it tighter, not looser.
Yeah, in the real setting, we probably cut it, right?
Mm-hmm. And in the real setting, they have Velcro straps, so they don't have these strings.
Well, they're half an hour trying.
Yeah, it's a Velcro strap.
Every how often is it changed?
Depends on the order, and it also depends on the patient as far as like how much mucus they have coming out. Most times we tell them every day. Even if they're at home with their trach, we tell them once a day to change their dressing around their trach. And they can do their own trach care at home. Home care nurse, we go in and just teach them everything, and the rest is on them. So
So during the test, he can come in and be like, the dummy said he wants to do it on his own.
Oh, Miss Dummy said she failed. All right, so any questions about it? So just get a system, make it real easy for yourself, and just go through it. The critical portion is the suction. That is the sterile part, because the last thing you want to do is put actual germs and dirt into their trach. So that's why you really want to maintain that sterile hand. For the cleaning part, you can see it wasn't really clean. It's just I have sterile gloves and it's a clean process, but you do want to hold it down. So don't be freaked out with the care portion. If your sterile glove touches, oh my God, I touched the neck, it's okay. It's the clean portion. It's the suction that you're most concerned with. And they always